Welcome to Medicine Information Factory YouTube channel. Today we shall discuss about Beraprost Sodium. What is Beraprost Sodium? Beraprost Sodium is an oral prostacycline analog that helps widen blood vessels and reduce the tendency of platelets to stick together. It is used to improve blood flow and reduce symptoms caused by poor circulation. Unlike many other prostacycline drugs that require intravenous or inhaled administrations, Beraprost Sodium is taken by mouth. How does Beraprost Sodium work? Beraprost Sodium mimics the action of prostacycline, a naturally occurring substance produced by the cells lining blood vessels. It works by dilating blood vessels, relaxes the smooth muscles in blood vessels, while improving blood flow and reducing pressure within blood vessels. Inhibiting platelet aggregation reduces the ability of platelets to clump together, lowering the risk of blood clot formation. Improving oxygen delivery. Enhanced blood flow allows more oxygen to reach tissues, especially in areas with poor circulation. Protecting blood vessels may help reduce inflammation and abnormal remodeling of blood vessels. Uses. Beraprost Sodium is approved in some countries for pulmonary arterial hypertension, helps improve exercise capacity and symptoms by reducing pressure in the pulmonary arteries. Peripheral artery disease improves blood flow to the legs, reducing pain during walking. Chronic arterial occlusive disease used in some regions to improve circulation in patients with narrowed arteries. In some countries, it may also be used for other vascular disorders based on local clinical guidelines. Benefits: improves walking distance in people with peripheral artery disease, helps relieve symptoms such as leg pain caused by poor circulation, improves exercise tolerance in selected patients with pulmonary artery hypertension, may reduce the risk of blood clot formation due to its antiplatelet effects. How is it taken? Taken orally, usually 2 to 3 times daily, depending on the formulation and the condition being treated. It should be taken exactly as prescribed by a healthcare provider. Do not stop the medication suddenly without medical advice. Common side effects. Because it widens blood vessels, side effects are often related to vasodilation. Common side effects include headache, flushing, dizziness, low blood pressure, nausea, diarrhea, jaw pain, swelling of the legs, palpitation. Serious side effects. Seek immediate medical attention if you experience severe bleeding or unusual bruising, chest pain, fainting, severe dizziness, difficulty breathing, allergic reactions. Precautions. Use with caution in people who have active bleeding or bleeding disorders, have severe low blood pressure, are taking anticoagulants, have severe liver or kidney impairment. Pregnancy and breastfeeding. Pregnancy, there is limited information on the safety of Beraprost during pregnancy. It should be used only if the potential benefits outweighs the potential risk to the fetus and under special supervision. Breastfeeding, it is not known whether Beraprost passes into breast milk. Breastfeeding decisions should be made in consultation with the healthcare provider, weighing the benefits of treatment against potential risk to the infant. Overdose. Symptoms of overdose may include severe headache, marked flushing, very low blood pressure, rapid heartbeat, dizziness or fainting, nausea and vomiting. Treatment is supportive and may include monitoring blood pressure, maintaining hydration, and treating symptoms. There is no specific antidote for Beraprost Sodium. Drug interaction. Beraprost may interact with anticoagulants, antiplatelet drugs, other medicines that lower blood pressure, other prostacycline or vasodilator medications. These combination can increase the risk of bleeding or excessive lowering of blood pressure. Summary: Beraprost Sodium is an oral prostacycline analog that improves blood circulation by relaxing blood vessels and preventing platelet aggregation. It is primarily used to treat pulmonary arterial hypertension and peripheral artery disease, helping improve exercise capacity and reduce symptoms caused by a poor blood flow. While generally well tolerated, it should be used carefully in patients at risk of bleeding or low blood pressure and under the supervision of a healthcare professional.